For establishing and managing an airway, you're going to first start with your PPE, so your gloves and your mask, whatever you need, and then you're going to establish responsiveness. So you'll do this by using the aptitude scale. So A stands for alert, so you're having a two-way conversation with them. V stands for verbal, so you are speaking to them, but they're not necessarily speaking back. But they're responding in some way. Pain is P, and that is, you can do that by like pinching underneath their arm or behind their ear, and they respond to the pain stimulus. And then U stands for unresponsive, so that they don't respond to any stimuli that you do to them. Next, you can establish their ABCs. So you're going to make sure that their airway is open and there's nothing blocking it. Breathing, make sure that they are breathing efficiently, and then from there you can see, like, are they breathing really fast, are they breathing really slow, what is their breathing at this current state. And then you can establish their circulation. You can just do that by like taking their pulse, and then you could go on further to like take their blood pressure as well. Next, you're going to establish if a head or neck injury occurred. So if the patient is alert, you can ask them if they have pain in their neck, or if they fell on their head a certain way, or they're having like a weird sensation. And from there, if they are having any of those, you want to assume that there could potentially be a head or neck injury. If the patient is unresponsive, you automatically assume that happened until further notice, until you know for sure that didn't happen, just in case, since they can't tell you how they're feeling at that current moment or what happened. So if you are assuming, or if it's suspected that a head or neck injury occurred, you're going to, if you need to open in the airway, you're going to do the jaw thrust maneuver. So it's kind of hard to do this on yourself, but you essentially like push the lower jaw forward, and that's going to open up the airway with keeping the spine in a neutral position, so you don't have to worry about the spinal cord being compromised if there is an injury. But if you aren't suspecting that, or if like you absolutely need to, you can also do the head tilt chin lifts maneuver, which is what you usually do when you're managing an airway. So you're going to tilt the head back, you're going to lift the chin, and then you're going to kind of like pull back on the nose and like the chin area to open up the airway, so that you can either get something out of the mouth or throat if they're choking, or if you need to like establish the airway using other methods, that's how you do that, or if you're needing to do breaths for CPR. And then you continue to monitor their ABCs as stated before, how you do that. And then you also want to make sure that there's no like foreign liquids or liquids from their body that are staying in their mouth and throat area, because that can cause them to choke. So like if they vomit, that's when you want to do suction, so you want to get that stuff out of there. Or if they're like excessively, like there's a lot of saliva or something in their mouth too, like you want to get that out with suction. And then after all of that's over, you take your PPE off, so you properly remove your gloves without touching the outside of the glove.